Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. As always, I am Parker Anderson, product manager here at RipsyTech, and I am joined by the ever so personable CEO and founder, Thomas Tarshis.
Hey,
Hi,
Parker. Good to see you.
Today's a bit of a special episode. You can see we're in a different setting. We're in person. And we're at AACAP 2024, the American Academy of Child and Adolescent Psychiatry, where our company RipsyTech had a booth. We met a lot of awesome people. And we're recording on Friday morning before people come in during the last day of the exhibitor hall.
Yeah, no, it's really fun to be doing this sort of special episode, and instead of being on opposite sides of the coast, we're both present here in Seattle. And it's been fun. It's our second conference here for RipsyTech.
It's true.
But I've been coming to these conferences for over 20 years, and I've had a booth for one company or another since 2009. So this is the 16th year.
Wow.
Had a booth at the AACAP conference.
Wow. It's my fifth AACAP since 2019. First three for me were all for presenting research and actually attending the conference as an attendee. And this is my second time with the booth at RipsyTech. And we've had a very fun experience, I'd say, this year.
Yeah. No, and the conferences are always fun, and there are these trade shows and conferences. It's a huge industry in the U.S., and the reality is for a lot of employees is a chance to get some nice travel paid for by the company.
That is a perk.
there is a degree of work, but it's also a time where people can see friends that they may not live near. You usually have downtime to hang out. I think you got to see a friend you haven't seen for a long time.
Yeah, a friend I hadn't seen since high school, but had connected with over social media the last few years. And so somebody I didn't think that I would ever get a chance to see in person. And traveling for conferences has definitely provided me little opportunities like that.
Yeah, so it's nice to be able to do that, and in our field, and RipsyTech's designed for all behavioral health clinicians, but since I'm a child psychiatrist, this is sort of the big child psych conference, and
Right.
Because I've taught at Stanford and UCSF for so many years, it's always nice to see, they seem to stay looking young while I get older, but to see all these people who were still, quote, students when I met them, and now they're, full-blown professionals, a lot of them with academic careers, and so that's always nice to catch up with people.
Yeah, I feel like I've experienced a little bit of that myself as a 30-year-old. When I first came, when I was 25, I felt very young compared to everybody else, and now I'm meeting people who are either medical students or maybe like in the residency or something who are my age, and I'm like, whoa, okay. That's a marker of getting older.
Yeah.
So, being here at AACAP, we had a booth. We've seen a lot of different booths here at the exhibitor hall. Some practices having their own booths. And you mentioned previously that you've had practices that had booths here at AACAP. So let's kind of talk about that. Like, what has your experience been with having a booth at a mental health conference?
Yeah, and this conference, I think, usually gets about 3,000 to 4,000 attendees. There's only about 8,000 or 9,000 child psychiatrists in the U.S., and so,
Right.
But a quarter of the attendee, but that's a good chunk of all the child psychiatrists. But there are a lot of non-child psychiatrists that attend also. There are some other conferences like the American Psychiatric Association, which is the second biggest medical conference in the country, that gets like 40,000 attendees. And that conference is quite overwhelming, just the number of things to do and the number of people there. And so I really like this conference better to have a table because it gives you more time to interact with people. We started coming with my nonprofit clinic back in 2009. I think we we used to bring in our own espresso machine and utilities, and
Yeah.
it was easier to sort of do that stuff back then. As you know, since you arranged the booth for us, they're very strict now about if you sure you can bring in your espresso machine, but you're going to pay a huge fee to the
Right.
company for not using their espresso service. And but it's a great way to I think like we try to be a fun company and have high energy, and I think having a booth that lets people see what your personality is as a company,
Yeah, absolutely.
finding some cool things to give away. And all these conferences, I used to go to a lot of talks when I was younger, but I really find that the favorite thing to do now is just reconnecting with other bright minds in the field and having those conversations versus maybe sitting 2 or 3 hours in some lectures.
Right.
That's what I feel like I get the most out of is those personal connections.
Absolutely. Yeah, I like that you mentioned the giveaways. I think as an exhibitor, there's definitely this experience or kind of feeling of camaraderie with the other exhibitors to kind of look at the things that they're giving away and saying like, oh, were those really popular? Oh, maybe I'll do that next year. And there's a little bit of like friendly competition as well. But we had ball maze puzzles and these little squishy dog stress relievers because our logo is a dog. And then we had mints, as I've been telling people, which are great for networking events. So yeah, it's been fun. And if you're listening and you met us and you got our ball maze puzzle, a few people had solved it right in front of us,
Oh
which
wow,
was pretty
okay.
cool.
I didn't see that.
Yeah.
Yeah, no, a big piece to these conferences is it does cost money.
Yes.
Right, yeah, you pay for yourself and your employees to come out, you pay for the cost of the booth. And I'm not sure what our total cost will be this year. Wait, do you know?
I put it on a spreadsheet so we can take a look at it later.
Yeah, but I think it will probably be maybe 5,000-ish with all costs.
I would say like hotels and the actual booth itself were the most expensive, and then flights. The giveaways, surprisingly, not as expensive.
Yeah, and we probably could have. I think we ordered an okay amount. This is all we had left, and we had to ration, so maybe could have gotten a little more. But
Yeah.
I think since we talk about finances and business a lot, you don't want to spend $5,000-6,000 for fun, right? That's not the point. And
Right.
so, there is this business term called customer acquisition cost, and it's if you spend X dollars on a conference and then you get Y number of new clients, you could sort of divide that and see if it was worth the money to go to the conference. It's not just black and white like that though, because we're a new company. We're kind of building our brand. We were at last year's conference, even though we hadn't really launched last year.
Right.
So we may get some conversions later or when we're back next year, just people continuing to see that we're a company that's still here and working and growing.
Yes.
But we have collected a few hundred leads.
We did. We were a bit aggressive with scanning people's badges, but people were happy to get their badges scanned. And if anybody asked, we let them know, like, hey, we're going to send you a newsletter. And that is a great opportunity for us to get a bunch of people who want to be on our newsletter or consented to be on our newsletter and be able to get into their inbox and just build the recognition of the brand and be able to send resources or just promote our company in people's inboxes. It goes a long way.
Yeah, and if we actually do get, let's say we do really well and get 10 new signups from this conference, depending on how many people are in their clinic or group, each of those could likely be like $1,000 a year of revenue. So if you do get 10 signups, that probably covered the cost of bringing the whole team out to the conference, plus building brand awareness. And, hopefully if for our practices that come, and there are a lot of mental health practices out here recruiting doctors, right? So if you come out here and you can hire a recruiter to find a doctor, and that might cost you $30,000 to $40,000, or hire a recruiter for a therapist, costs less. But if you come to a conference and do it yourself, that might only be $5,000 or $6,000, and that's saved yourself a lot of money to get that employee for your practice.
Right. So yeah, I had a question about that when it comes to, growing your practice. When do you feel like is kind of like a good time to consider getting a booth at a conference like this for recruitment?
In your business model, and we've talked about this a little bit on some other episodes, that once you're kind of full in your practice, but you've decided you're going to do more than just a solo practice and are ready to hire people, once you're filled, but you're still getting referrals for patients, and you know that you have enough to start filling some other people's schedules, that's the time to start hiring new people. And there is a delay, right, to get from when you hire someone to when they start and see patients. So even if you can predict like, hey, in 3 months I'm going to be ready, then that's the time to go out there and start recruiting.
Yes. I mean, how does the customer acquisition cost apply to, hiring for a clinic versus, us where we have a product and we're looking for clients? How does that work when it comes to bringing somebody on as an employee who's going to generate revenue, but you're also going to be paying?
Yeah, so in mental health clinics, your product is delivering mental health services. So if you know that hiring, let's just say if you can bring in a psychologist, they're going to generate an extra $40,000 for your business after you've paid them and their schedule's full. If you that's going to be your metric for how much are you going to spend in order to get that person hired to be able to cover the costs. And it's a different metric because it's very, in a model where you have an employee that's bringing in overall revenue to your clinic, it's actually okay to spend a much larger amount to acquire a new employee who's going to deliver services. Usually for white service jobs, they do it more in salary differential for the employee. You could actually break it down into how much are you spending in order to provide extra therapy or mental health appointments in your clinic. But,
oh yeah, okay.
so there are other models and ways to do that, but I think the idea would be, if we know a physician that we get filled is going to bring an extra $60,000 of revenue to our clinic, most people would say it's okay to spend $30,000 to $60,000 to get them, because then after a year you've recouped that cost and then you're generating more revenue and profit for your business.
Very interesting stuff. I love it. So I'm thinking a little bit about for us as a product, being able to have this opportunity to share more of ourselves and share our special AACAP deal, 3 months for the price of one, if anybody's wondering. Valid through the end of 2024. What were some things that you kind of noticed or stood out from the people that we got a chance to talk to this week?
Yeah, I think we had a really, it's not sort of dotted and signed and finalized, but we do have a partnership brewing with an AI company for recording sessions and automatically generating notes. And I think AI is the biggest thing maybe in the world right now, but for clinicians, it's always been the bane of the existence to write our notes. We talked about this a little bit on our AI episode, but our very likely partner, we managed to get like a nice beta version of the AI service integrated on the same browser window with our EHR. And we were able to demo, I think, the funnest thing was being able to demo that for people who had never seen what an AI note could do. And we have a little fun with it where I pretend to be kind of a difficult patient. And for our, there's a lot of trainees still here. And it's a great opportunity to put them in the role as the clinician and see how they handle a difficult patient.
Yeah.
But then just doing like a little 3-minute therapy session, watching the AI generate a clinical note from that. And then instead of having to copy and paste this over, you click a button and it automatically goes into the note. And we had some, it went very well. Everyone was very impressed. We had one gentleman who is more closer to my age, who's been practicing for 20 years, who literally said, "Wow, this is like magic." Yeah, so I think the AI has been really cool to demo that. I think we've made some other connections and conversations. With the other interesting thing I've noticed this year is, there still continues to be a lot of new mental health startups.
That's
And
right.
there are some people who, are not necessarily in the market for an EHR, but they have a role as a clinician for one of these startups. And then we're able to see our product and what it can do with measurement-based care and patient outcomes.
Yeah.
And then they were like, whoa, we're doing this new project and we actually don't have a way to know how it's going. And this could be some good synergy. So we're able to make some connections with people like that. And you never know, the one thing I've learned is sometimes you feel like you make these really strong and great connections. And you're like, oh, we're going to really take off and do this. I think we had one or two people from last year's conference I felt that way about, and sort of didn't materialize, and learn to not take those things personally, and people are busy. And
Yeah, I mean, it's always, I think with us doing a lot more like sales calls or like demos for people, you do kind of get a good sense of, you do all this work, you develop a good positive relationship with somebody, and, sometimes it pans out, sometimes it doesn't. And, yeah, it's not something that you take seriously, or sorry, it's not something that you take personally.
personally, yeah.
Take it very seriously. It's not something you take very personally, because I mean, there's a million different reasons. And I mean, we have people kind of coming up to us saying like, oh, I use this system, I'm part of a group, or we're part of a hospital system. And it's like, perfect. There's I'm not here to try and sell our EHR to you, because one, you don't have much of a choice with what you have if you're in the hospital system, but also like that's not really our target customer base. So to at least still be able to kind of like talk about our product with those people, and some people thinking about starting a private practice at some point, I think it's been really valuable. And to talk about the podcast too as kind of like a resource that we're providing, that perked up a lot of people's ears as well, which is very exciting. I hope a lot of people who we met are seeing us right now on video, and see our awesome RipsyTech hoodies that I'm wearing right now that we got made. So yeah, it's been a very fun experience this year.
Yeah, I think that's been nice, because a lot of people are using this to maybe launch, talking about private practice, and for us to be able to say, hey, we've got 30 episodes recorded to help you along this path. And I think the coolest thing was the one young man who's like, oh, I've got a long flight to Italy, and right in front of us started downloading our podcast to listen to. I'm sure he got, hopefully it didn't just put him to sleep right away on his flights to Italy, but
yeah. Probably checked out that first episode and said, hey, this guy's video is super overexposed. What's going on? Shouts out to the first episode and my technical problems back then that we figured out. So I mean, it's been a lot of fun. Oh gosh, yeah, it has been really awesome to just speak with people and kind of like have them get to know us and kind of be able to share our mission. And part of our mission is that we're doing this with a purpose and not particularly for profit. And I had an awesome woman who complimented me for she'd asked me questions of like, oh, like I'm part of a hospital system, but we want to use AI notes. Like, could I use your system and the AI notes together to be able to use that, but I still use my own system? And I just kind of told her like, well, actually, I think you should just get an account with our partner rather than going through us. You don't have to use our software to be able to do that. And she was like, wow, I appreciate that honesty. It's like, we're not, our purpose here is, well, yes, we want to, attract new clients and make money and, keep our customer acquisition costs hopefully as low as possible. But at the same time, like, we want to be clear with people that we are here to, really try to make your lives easier and be honest business people. And it just feels good.
Yeah.
Awesome. Well, any other fine topics that you're interested in talking about pertaining to conference experience?
Yeah, I think the one thing for some smaller practices or people going out or looking to hire clinicians, this conference is something that's national. You have to fly to. It's a little pricier. There are, though, a lot of local conferences, like in every community.
That's true.
So, there's regional meetings for different, marriage and family therapists, social workers, psychologists, general mental health conferences. So there's sometimes, regional areas. There's statewide conferences depending on the size of your state. And there are some things that you can probably just drive to that it is very inexpensive to get a booth and exhibit at.
Right.
And that's a very cost-effective way to go and meet people and talk about your company or what you're hiring or what you're trying to get out of it. I think there's, one of the things we were going to talk about is, are there negatives to attending a conference? And I think that, even if you go to a conference and you learn that people don't like what you're offering as an employer or not, like there is a lot to learn from going to different conferences. It's hard to say that there's anything negative because if something negative happens, it's actually a good learning process for you.
Absolutely.
In what you're, if you're trying to hire someone for your clinic or, you have whatever you're doing or your presence is about at a conference, getting that feedback. And that's how, we've been doing this for a lot of years. So I feel like I know a little bit about what I'm doing, but we still get other feedback that can be helpful. But I remember at the beginning, it was a lot more chaotic and stressful, and we weren't as smooth, but then getting the feedback from going to those earlier conferences
Absolutely.
has helped. And you don't be discouraged if your first conference you go to try to hire people, you just get a lot of glares and don't hire anyone. Like, don't let that discourage you, I guess.
Yeah. So Ryan, our guy behind the camera who helps make the podcast possible, he and I were talking over our coffee this morning about it's kind of been like a good customer research experience for us as well, to kind of come and see what people are interested in, what people are looking for, have people use the product and say the things that they do really like, and then for me to get to be like transparent about saying like, I'm the product manager, so I love to hear the feedback. I'm not just here trying to sell the thing to you. I'm also trying to make it better, and having people be honest about like, okay, like, yeah, it'd be really cool to see it be able to do this. I also really love these things, and it's very validating, and also, just a great opportunity for us to have a chance to listen to like live people en masse in a very short amount of time.
Yeah. For us demoing our product live, like number one, knowing like getting experience doing that and not having things crash and making sure it's a good experience. But then, yeah, exactly for what you said, the feedback in the moment about what's cool or what needs to be made better is invaluable product research for us. And very helpful as the company moves forward.
Absolutely. So, anything else you'd like to discuss before I move on to our ending portion?
No, I think we're good. I know we're about to hopefully get some more visitors to our booth here. So
people are walking in this morning. You might have noticed, if you're watching on video, the lights turned on maybe like 10 minutes in. Okay, well, let's talk mental health business moment of the week. I'm springing this on you. Okay, so we're at a conference. You haven't been able to see your patients. What was your strategy around that for travel?
Yeah, so what we try to do when we're at the conferences, I put on a pseudo vacation responder, which is, I still manage to sort of check in on email and be available a little bit, but I do put in the responder that it's going to be limited access.
Mm-hmm.
But we do have texting through our clinic. So if there is something urgent, go ahead and text me rather than sending an email, and I'll be able to respond to you. As always happens, I think there was, maybe one urgent patient issue and then a couple little business issues to deal with around collecting some fees or one or two things with an insurance company. But overall, it's just been really Wednesday, Thursday. Today's a half day, so my strategy is to let people know you're at a conference and that you might not, if they're used to a certain level of responsiveness,
Right.
might not get that. But for our clinic, you can go ahead and send me a text message,
Yeah.
and I'll get back to you sooner.
That sounds great. All right. Well, that wraps it up for our special AACAP episode, live and in person. Well, maybe not quite live, but this episode will be going up next week on Wednesday. So I hope people enjoy that, and anybody who subscribed to our newsletter from having their badge scanned at the conference, we'll be sending out a newsletter on Thursday.
Awesome.
Yeah, and that about does it.
Very good, Parker.
All
I'll see you in a couple of weeks on separate coasts.
That sounds good. All right. Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.